If you're an American citizen, you've been to a hospital in the last few years, very often somebody who's there in the emergency room waiting is an illegal alien, very often a person who can't even speak English. Why do those people get health care benefits paid for by American citizens?
Hi, my name is Dr. Rubin, and what you just heard was a lie. It turns out back in July, the Trump administration restricted access for undocumented individuals to have access to certain federally funded health clinics, Head Start, and some other initiatives. They did not touch EMTALA, which is a law signed by President Reagan in 1986. That law basically says that if anybody shows up to an emergency room, you have to take care of that patient regardless of their ability to pay. That was in response to a practice that was happening for many years called patient dumping, where private hospitals would take patients who could not pay and they would take them by ambulance and dump them to public hospitals, which made those places overcrowded and was very dangerous.
This week, the Vice President of the United States got on TV and blamed immigrants for long emergency department wait times and suggested that they should not get care at emergency departments. This is particularly frustrating for me because a couple of weeks ago, I made a video where I suggested that it just seemed pretty incongruent to go through medical education, learn about social determinants of health, and then see the impact of public policy, whether that's positive or negative, and continue to support the modern conservative party that continues to push public policy that we know will harm patients. In the comments of that video, I was accused of believing that conservative individuals can't be good physicians and that I, as a future provider, would likely not provide quality care to people that I perceive as being conservative. And let me make this 100% clear so there's no confusion. I have never stated, nor do I personally believe, that conservative individuals or people who identify as conservatives can't be good physicians or clinicians. And I have never and will never withhold or modify treatment for a patient based on my perception of their identity. I just think it's particularly wild that someone who is at the top of leadership in the conservative party in the United States is getting on TV and saying that certain individuals are less deserving of healthcare simply because of where they come from or the fact that they don't have the right papers or didn't come here, quote unquote, the right way. That is not how ethical healthcare works, and it is incredibly concerning that someone with such a platform as the Vice President of the United States is pushing this type of rhetoric.
So if you get your health coverage on the ACA marketplace like I do, expect your health care to be on average 75% higher come next year. Many people will lose health care entirely because it'll become unaffordable. That is the actual consequence of Republicans' actions. They refuse to extend the already existing subsidies. It's not like Democrats are asking for more than they had before. They just want to continue the existing subsidies. And as a result of that, millions more Americans will suffer beyond just the 17 million Americans who are already going to lose Medicaid at the hands of this Republican Party. But Republicans can't come out and admit that because that would be far too unpopular, and so instead, they had to make it into a culture war. It's not the Republicans who want to just blindly rip away healthcare. It's those dangerous, illegal immigrants who want to take it from you, and so we, the Republicans, are actually here to protect you from being ripped off by them. See, now it's not rich Republicans against working class Americans. Now it's working class Americans versus working class brown people. That is where the GOP is far more comfortable. They just need to pit poor people against other poor people in hopes that nobody realizes that the rich people are fucking everyone over.
Thanks very much for joining me. Let's be clear. Our healthcare system today is incredibly broken, dysfunctional, and cruel. 85 million Americans are uninsured or underinsured. We pay the highest prices in the world by far for healthcare. 1 out of 4 Americans can't afford the outrageous prices of prescription drugs. We don't have enough doctors, nurses, dentists, mental health counselors, or other healthcare professionals. Our life expectancy is already far lower than other major countries. Yes, our healthcare system today is already broken. And in my view, in order to remedy that crisis, we have got to do what every other major country on earth does. Not a radical idea, and that is to guarantee health care to all people as a human right. But what I have to tell you is that in the midst of all of this, the dysfunctionality of the current healthcare system, Donald Trump and his friends are making a horrific situation even worse. In fact, they are pushing our healthcare system over the edge to the verge of collapse. Now, you think your health insurance costs are high right now? You think you're already paying the highest prices in the world for health care? Well, guess what? Within the next couple of weeks, millions of Americans are going to get a letter from their insurance companies telling them that their insurance premiums will double. Let me repeat. As a result of Trump's big, beautiful bill and massive cuts to the Affordable Care Act, your health insurance premiums for 24 million Americans are going to double. And maybe even worse, could get worse. As part of that big, beautiful bill, 15 million Americans will be thrown off of Medicaid and the Affordable Care Act. Studies from Yale University and the University of Pennsylvania suggest that when you throw 15 million low-income and working-class people off of the health care they have, some 50,000 people will die unnecessarily every single year. It's not hard to figure out why. If you're low income, you're working class, you're sick, you don't have any health insurance, you can't go to a doctor, you can't get into a hospital, you know what? You're going to die. 50,000 people unnecessarily every single year. But it's not just insurance premiums or getting thrown off the health care that you have. As part of these awful cuts, nursing homes in America are going to be decimated. My office has studied some of this. The nursing home situation in America today is a disaster. They're understaffed. And the way we treat the elderly and disabled who are in nursing homes is something we should be ashamed about. But guess what? When 2 out of 3 people in nursing homes are dependent on Medicaid, that situation is going to become much worse. Rural hospitals are going to be hard hit. Republicans like to talk about investing $50 billion into rural health care. But what they somehow forgot to tell you is that their cuts in the bill are $150 billion. In other words, they put $50 billion in after taking $150 billion out. That's a loss of $100 billion for rural health care. Further, we're talking about community health centers. 32 million Americans, all walks of life, get their health care, primary health care, dental care, mental health counseling, low-cost prescription drugs from community health centers. They are going to be decimated as a result of these cuts. So my friends, this is, in my view, what this government shutdown is all about. Republicans want what they call a clean CR. And what that means, for the first time ever, what they want to do is push forward a bill and get it passed without any Democratic input. Now, in the Senate, the rules are clear. They need 60 votes. And what that means always is there has to be bipartisanship. You want 60 votes, you got to have both parties coming together. Republicans are not doing that. They're not negotiating. They're simply saying, take it or leave it my way or the highway. Well, many of us in Congress are not going to take it. So that is what this whole government shutdown is about. Now, you may not hear much of it from the media, or you may not hear it from most Democrats or Republicans, but that is the simple truth. So let me be as honest as I can be. And that is, I do not intend to vote for legislation that will allow 50,000 Americans to die unnecessarily every single year. Ain't going to get my vote. So let me conclude by asking for your help. I can give all the speeches I want. Other members of Congress can give great speeches. They do fine. But what's more important is that my colleagues hear from you. So right now I am asking people all over this country, including you, you, to share your story. I am the ranking member of the Senate Health, Education, Labor, and Pensions Committee, and I want to hear from you as to what a doubling of your health care premiums will mean for you and your family. I want to hear what it will mean if you are one of the 15 million people being thrown off the health care you have because of the massive cuts to Medicaid and the Affordable Care Act. I want to hear from you as to what it will mean if you have a family member in a nursing home and that nursing home has got to cut back on staffing because they don't have the funds or maybe even shut down. What does it mean if you're currently visiting a rural health center, you live near a rural hospital? The time is now for the American people to speak up. So I would very much appreciate hearing from you. Thank you very much.
Two COVID-era Medicare programs, telehealth benefits and in-home hospital care, have ended abruptly for millions of Americans as a result of the government shutdown. Authorization for both expired on September 30th, and Congress failed to pass a new budget plan for either. That means many seniors on Medicare can no longer use telehealth services. The program now reverts to pre-pandemic criteria, meaning Medicare enrollees in rural areas can still use telehealth, but in a designated hospital or clinic. Meanwhile, in-home care recipients will either be discharged or go back into inpatient hospital care. For more on this, I'm joined by Kyle Zebley. He's Senior Vice President of Public Policy at the American Telemedicine Association. Thank you for being here.
It's great to be here. Thanks so much.
So let's take each of these programs in turn. When it comes to telehealth or the virtual appointments, we saw a surge of use in the pandemic, some 7 million people using it last year. Who's going to be most impacted by this shutdown?
By our older Americans and most disabled Americans. They had access to something when they went to bed on Tuesday night. They woke up with the government shutdown on Wednesday, and they found out that they no longer have access to these programs and flexibilities that have been in place for more than 5 years, since the beginning of the decade, since right before the real impact of the COVID-19 pandemic came to the United States.
And the change is now reverting to these pre-pandemic criteria. Explain that to me. If you're enrolled in Medicare and you live in a rural area, you can still use it, but in a very specific way?
That's right, and you said it well at the outset. You have to meet two criteria, and you have to meet both. You have to be in a defined rural area, and you have to be within the four walls of a Medicare provider's office. It's head-spinning to go back to these restrictions. They were put in place in law in 1997. That may have been advanced at that time. The technology had moved forward leaps and bounds by the beginning of the decade before the COVID-19 pandemic. We had been clamoring to get these flexibilities put in place, and it took the COVID-19 pandemic to do it. Now, unfortunately, all that progress goes away. And has been now 2 days into this shutdown.
So potentially we're talking about millions of people having their health care, access to health care impacted. What does that mean, big picture?
Well, it means most importantly that patients are worse off today. They have less access than they did 2 days ago. It means that for patients receiving cancer care, mental health areas of treatment, primary care treatments and visits, they no longer have access to this care that's clinically appropriate, care that meets them where they are, that is far more flexible than, of course, going into in-person settings. It drags us backwards not only to the beginning of the decade, really, again, in effect to 1997, when these provisions were previously put into place in law.
And hospital systems, healthcare providers have a choice to make here, I assume. Could they continue to provide this care and hope they get reimbursed? Are any doing that?
So many are making really tough decisions. They are either making the determination that they don't have the financial wherewithal to potentially eat these costs, and therefore, unfortunately, they're alerting patients now every day, every hour, practically speaking, across the country that they're no longer going to get those telehealth services they've come to rely on. That's expanded access to care. There are other healthcare systems and Medicare providers and provider groups that are saying, we're going to weather the storm at least for a little while. We're going to continue to offer these services because we want to continue to offer care to these patients we care so much about. And hopefully the federal government and Congress will come together, bring these programs back, and retroactively pay for the services that were rendered during this lapse. That's certainly what we're asking for, and we hope our bipartisan telehealth champions will get it done when cooler heads prevail and the shutdown ends.
There's also this other program, the in-home hospital services program, that's been paused. So patients, my understanding, are basically monitored virtually and they get daily provider visits. So what happens to those patients now?
This is really clear cut. If there's any ambiguity or flexibility that is present for the Medicare telehealth flexibilities, that's not present here. The Office of Management and Budget and the administration has made very clear that that program is ended, and it ended effective October 1, yesterday. And they had instructed anybody that was participating in that program, they need to be either, as you said, sent home, or they need to go back into a hospital setting. They were comfortable at their home. They were getting clinically appropriate care. They were getting care that they wanted to receive in this manner to convalesce at home. It also opened up capacity in the hospitals. That capacity increase has now, of course, gone away. And it's really stressing our overburdened healthcare system to force this to go back into place.
Even just in the last 24, 48 hours, are you seeing the impact of that? Are facilities becoming more crowded?
Oh, it's a devastating impact. It set us back again. significantly from bipartisan, hard-won progress that we have made since the beginning of the pandemic. What's a real tragedy about this is, yes, Americans are losing out. They're losing out every day, increasingly so, the longer that these flexibilities have lapsed. And it's a real shame because these are popular bipartisan programs put in place by President Trump, kept in place on a bipartisan basis in Congress, really with no stated opposition throughout the Biden-Harris administration. President Trump's been on the record in support. He already signed an extension of these flexibilities earlier this year. We really want to get out of the short-term thinking, get out of this discussion of having endless short-term extensions. These programs should be made permanent. And if things were functioning as I think they should, we would have been made permanent long ago. But here we are, despite all that broad-based popularity, caught up as a victim in circumstance because of the shutdown.
Well, until that shutdown ends, for anyone watching this at home who may be impacted by either one of these changes, what's your best advice to them? What are their options?
Well, their options are to hope that their providers and their healthcare systems that they're working with have the ability to continue to deliver that care, even though they might not be covered and reimbursed. But most importantly, and ideally, they pick up the phone, they call their member of Congress, and they say, please end this shutdown of the Medicare telehealth flexibilities in acute hospital care at home. You don't want to sit on the sidelines if you care about this, if your loved ones are depending on it, if you yourself are depending on it. You need to have that agency to try to make sure Congress gets the message that it's unacceptable to have these popular bipartisan programs lapse, and we shouldn't be a victim of this other dynamic that has nothing to do with our community and the people that rely on telehealth.
Kyle Zebley with the American Telemedicine Association, thank you so much for being here.
Thank you.
One in 6 registered nurse is an immigrant in the United States. 1 in 7 licensed practice nurse, or LPN. 1 in 5 medical assistants in the United States are immigrants. 1 in 4 certified nursing assistants, or CNAs. 1 in 3 home health aides. 1 in 3 patient care technicians, or PCTs. 1 in 2 environmental service workers, EVS. 1 in 3 food and dietary service within the healthcare system. 1 in 2 hospital transport workers, especially in major cities. 1 in 4 phlebotomists, the people who draw your blood. 1 in 5 radiology technicians or MRI technicians that I work with all the time. 1 in 3 dialysis technicians who help patients with end-stage kidney disease. 1 in 4 surgical techs or scrub techs who assist in all of our surgeries. Our healthcare system absolutely runs on immigrants. Thank you for coming to this country and supporting the healthcare system to help keep our country healthy.
Do Democrats want to give illegal immigrants health care at your expense? Is that what the government shutdown fight is all about? Is it really based on a word game that could actually cost Americans hundreds in health care? Here's the trick that President Donald Trump and Vice President J.D. Vance are playing on you. It's a word game trick. Yes, some migrants get health care benefits, but they're not illegal immigrants. They're called lawfully present. They include refugees, asylum seekers, DACA recipients, people with work visas. They have legal status. They pay taxes. They're following the rules. Back in March, Republicans stripped health care from 1.4 million of these legal immigrants in Trump's tax bill. Now the Republicans are calling that same group illegals to make the Democrats look bad for wanting to restore the cuts. And the actual undocumented immigrants, the illegal immigrants, they can only get emergency room care, which is a fraction of 1% of healthcare spending. They can't get Medicaid, they can't get Medicare, or ACA subsidies. That's been the federal law. Since 1996, nothing has changed. Here's what matters to your wallet. Without these ACA subsidies, 24 million American citizens will see premiums jump 75%. That's hundreds of dollars more per month for health insurance for American citizens. So don't fall for a word game. The fight here is about keeping healthcare affordable for Americans. Share so people know what's really at stake. What do you think? You can drop your comments below and follow me. I'm Sue O'Connell. I'm a political commentator, and you can watch me on NBCBoston.com and on YouTube.com/NBCBoston.
Vice President J.D. Vance just gave the clearest explanation that I've heard yet as to how it is the Democrats were trying to push forward health care for illegal immigrants paid for by American citizens to avoid the shutdown.
This is a Democrat talking point. They say we're not actually trying to give health care benefits to illegal aliens, and here's why it's not true. There are two Biden-era programs that explicitly gave the taxpayer health care money to illegal aliens that we turned off when President Trump took over in January. Program number one is there's a lot of emergency health care at hospitals that are provided to illegal aliens. That was funded by the federal government. We turned off that funding because, of course, we want American citizens to benefit from those hospital services, not to be taxed and then to have those hospital services go to illegal aliens. The second of which is the Biden administration gave mass parole to millions upon millions of illegal aliens, and then they simultaneously made those parolees eligible for health care benefits funded by taxpayers. In the One Big Beautiful Bill, President Trump and congressional Republicans turned off that money to health care funding for illegal aliens. The Democrats want to turn it back on. And in their initial proposal, the first thing that they put out to reopen the government, they actually turned that money for health care benefits for illegal aliens back on. So it's not something that we made up. It's not a talking point. It is in the text of the bill that they initially gave to us to reopen the government. It's preposterous for them to run away from it now. But look, let's set that all to the side. Let's open up the government. Let's negotiate on all of these healthcare policy issues. Obviously, we're not going to support healthcare benefits for illegal aliens, but we will work with them to lower healthcare costs for American citizens if they're willing to do so.
For all you liberals and leftists who are going to try to say Republicans own the House and the Senate and the presidency, this is their fault. And you obviously don't know how it works when it comes to passing spending bills. Because when it comes to spending bills, you need 60 of the senators to agree with it in order for it to be passed. So the Democrats are trying to use their minority to force through or repeal things that were done during the One Big Beautiful Bill. We only need 7 Democrats or independents to cross the aisle to pass the continuing resolution that Republicans already passed through the House so that they can debate these other issues on Congress's time while keeping the government open. I guess it really is a Schumer shutdown, huh?